Seated knee, the simple problem, especially passive, is the ability to generate proper flexion, because either you have to elevate the leg, which has some effort. So if I'm sitting down, I can put his foot on my thigh. I'm not going to do it. And then you get the ability to get full flexion, but then you have a bunch of hip flexion. So maybe their hips pinching and there's all this other stuff going on. So if you wanted to generate traction in the knee, seated's great. If you wanted to generate rotation in the knee with traction, seated is pretty good, but I have to be compromised. I have to be kind of rolled over. If you would be so kind as to lay on your back, my friend. Okay, so knee flexion and extension here. I could overpressure, right? I could do that. That's knee, like kind of a terminal knee extension. I can be here, fairly soft. I can do this, right? Well, it'll extend and it won't hyperextend, right? So I can do that. That is an option. It's not a particularly clean test. I cannot check knee flexion here, right? But I can check, so I can check it here. I can do this, right? But that, there's a little bit of work, extra work for me. Feels awkward to you,
A little bit.
right? So you can check the knee here. You can kind of palpate. So if I just go here, gravity helps. I don't have to work very hard. That, I can overpressure his knee, but that's not nice. There you go. It closes. Now, if I'm not looking at it properly and I'm thinking, wow, that's not enough degrees, then I'm just not acknowledging that it's squishy, right? Like, oh, it has to go farther. It has to go farther. No, it doesn't. Squishy, right? No problem. Now, to check extension here, because I've generated hip flexion, I'm going to generally run into hamstring tension on most people. I can't check it. Like, this isn't going to work. I got to bring them down here. So something like that. Yeah, it works, right? As far as rotations are concerned, I can get information about rotations here. Now, if I hold the foot, I'm going to confuse myself because of that. If I hold the shin, I can hold it underneath. I can hold it on top. Either one is fine. I'm going to hold it underneath because it's going to feel too weird. If I pay attention to my hand, I can confuse myself. You see this? Right? I can confuse myself. I don't want to confuse myself. So I look here and I feel here. Yeah, not too bad. Did you feel that buzz? That was weird.
Was that you or me?
No, that's you.
Oh.
Dude, I don't buzz. So what the buzz sensation is, if I was to make a guess, there's some kind of connective tissue that as we put some tension on it, it vibrates, right? I've never felt that in my life before. That was cool. Was it good for you?
I didn't hate it.
I didn't hate it? Sweet. Let's try again. So some knees have crepitus in them. They're creaky. They sound like old floors. It's probably something that may turn into crepitus in the future, but I can get the rotation there, right? If I pay attention to this arm, I'm confused. Look at how wiggly his knee is. No, you have to pay attention here. So lay on your stomach for a moment. It's the same thing in prone. In prone, you will be able to get some information about flexion and extension. Not much about extension. Like, this is not nice. Don't, like, this is weird. Don't do this, right? The flexion, again, you're just going to find the soft tissue approximation, right? Look, there's such a bouncy end feel. So bouncy. I'm making fun of things I've heard. So, with prone, you act, orthopedic testing-wise, you get your Ackley's compression, right? You're testing the meniscus. You don't have to compress it. You don't have to test the meniscus. You literally just put your hand here. So the table is going to relatively stabilize the femur, right? Again, if I hold here, I'm going to screw it up. There's another joint in play that has a decent amount of movement. So I can, right, look at, it'll work, but if I pay any attention to this arm, it's going to seem like something big is happening here, but it's something big happening here. So if I hold here, right, again, I can roll all over this and not get a ton of movement. So I cannot pay attention here. It will confuse me. Moves pretty good. Doesn't move bad. Right? I could do something here. This hand is not particularly active. I'm sensing around the yoke. Right? Like just around the yoke is what I'm sensing. Does something. Does something. I'm not too concerned about this knee in particular. If we want to turn it to treatment, then we just make sure we stabilize it a little bit more, give it some traction, and give it a wiggle. But it's not treatment now, it's assessment now. So the knee, probably most effective to check in supine, but I have to make some concessions as far as positioning is concerned. And I have to make sure that I'm paying attention to the knee and all the things around the knee, as opposed to, so if I'm flexing the knee, what I'm feeling, I have to see. If I can't see it, I have to acknowledge that it's probably just a hamstring and a calf. I can't meaningfully test the knee with a relatively flexed hip because I built tension into the hamstring. So I have to make a concession positionally. So if I talk about it, it sounds way more complicated than it is. If you just do it, it's like, yeah, it's pretty simple. Straighty, bendy, wiggly, wiggly, right? No big deal. So if you're concerned about the knee, supine is probably a great place to figure out a bunch of information. If you need to work on it, you're probably going to work a lot in prone, and if it hasn't cleared up, then you do more in supine.